This video will demonstrate the procedure for administering enteral meds and feeds via a nasogastric tube at the same time. Remember the process for each regarding flushes if administering meds and feeds separately. The nurse will be administering 0900 meds and feeds to Sally Wright in 205 door. The nurse will first complete hand hygiene. She will then get the correct chart from the chart rack in order to check the doctor's orders against the orders in the Medication Administration Record, or MAR. Each medication order is checked from top to bottom on the MAR while looking at the most current doctor's orders on the chart. The nurse will also compare the type of enteral feeding in the doctor's orders to the orders on the MAR. Be sure to look at all the pages of the MAR for medications. Take the patient identification band off of the chart and place it into the drawer to use when in the patient's room. Following the medication reconciliation, the nurse minimizes the screen before leaving the cart to replace the chart in the chart rack. Return to the cart, perform hand hygiene, and open the medication list. The process of checking the MAR to the doctor's orders is the same as in PO medication administration. The nurse will now proceed to pull the correct medications out of the Pyxis. To access entry to the Pyxis, type in student and use the password 1nursing. Type in the first letter of the last name of patient and choose the correct patient name. Start at the top of the MAR and find each medication on the Pyxis screen. Click on the screen as was done with PO medications. If screen pops up on the Pyxis, read the screen and proceed, or ask the evaluator if you are unsure. When all the meds are entered, the nurse will pull each medication and scan it. This is the first check. After all meds are pulled from the Pyxis, the nurse completes the second check. This is done by comparing each medication to the MAR at the WOW manually. The nurse will look at each medication starting at the top of the page and compares it to each medication. Be sure to look at the 0900 medications only and be sure that you have the right dosage of the medication. put all the medications in the drawer. Never leave the medications on top of the wow. Minimize the screen before leaving the med room. Leaving the screen open is a violation of the HIPAA law, which protects the patient's right to privacy. The nurse is now ready to go to the supply room to obtain the correct formula for the NG feeding. Open the MAR screen and compare the correct formula, Ensure, with the MAR. Also check the can for an expiration date. Other supplies you must take with you are a feeding bag, an irrigation kit with a piston syringe, a pH strip, your goggles, a pen, and clean gloves. The student will use their own box of clean gloves during this evaluation. The pill crusher will be on the wow. Minimize the screen before leaving the supply room. The nurse will now go to the patient's room, perform hand hygiene, and open the MAR screen. She will then identify herself.
My name is Stacy Daniels, a student nurse for NCCC. I'm here to administer your 9 a.m. meds through the tube in your nose and your feeds. Can you tell me your name?
Sally Wright.
Date of birth?
5/27/1950. Identify the patient times 2, name and date of birth, and check against the MAR. Assess for allergies.
Do you have any allergies?
No, I do not. Check against the MAR. Now check the MAR screen and make sure that the box in the upper left-hand corner is highlighted before scanning. When scanning, the word no changes to yes. This lets you know that you have the correct patient. Okay, now we'll elevate the head of the bed at least 30 degrees in order to access the NG tube. Elevating the head of the bed 30 degrees must be done prior to accessing the NG tube to prevent aspiration of medications or feedings. Put on clean gloves and goggles. This must be done prior to accessing the tube for standard precautions. The next step is to assess for tube placement in the stomach cavity prior to administering meds and or feeds. You will need a stethoscope and the piston syringe to check for proper placement. You will also need a pH strip. The nurse will pinch the tube, check placement times 2, first by inserting 10 milliliters of air, swish method, and by checking the pH of the stomach contact. It must be 5 or less. So the nurse inserts 10 milliliters of air into the tube. While inserting the 10 ml, she auscultates over the left upper quadrant of the abdomen, listening for a swishing sound. Immediately, without removing the syringe, aspirate the stomach content. If the amount fills the syringe, empty it into the irrigation tray until the total amount is aspirated. If the residual is less than 250 milliliters, return all of the stomach content back into the tube except for 5 milliliters. Use this amount to check for pH with the pH strip. The meds and feeds may be given if the pH is 5 or less, signifying that the tube is in the stomach cavity. Perform any other assessments needed prior to giving the medication. If you are giving digoxin, you must check an apical pulse for 1 minute and hold if it is less than 60 beats per minute. Now that the nurse has completed these assessments, the patient may have the medication administered. Fill the graduate with 200 milliliters of water. This will help with dissolving the medications and flushing the medications. This amount is used to assist with calculation of intake and output. Complete the third check of medications by scanning each med. Be sure that the box is highlighted directly below the medication on the MAR screen. The nurse can now crush all the pills together, put them into a medication cup, and pour enough water to cover the meds. Remember to review meds that can't be crushed, for example, enteric-coated medications and time-release pills. Never crush a capsule. If it is unbanded, it may be opened and added to water. A banded capsule cannot be crushed. The nurse will now pour the liquid medications separately. Prior to administering medications through the NG tube, the tube must be flushed with 30 milliliters of water. Be sure goggles are on before accessing tube to prevent splashing into eyes. Remove the plunger from the syringe. Pinch the tube. Put the syringe into the end of the tube and pour 30 milliliters of water into the syringe. Crushed medications would now be given by the NG tube. However, in the lab, this is verbalized only. Do not pour crushed meds into the mannequins in the lab. You may give the mannequin any liquid medication. Administer 10 milliliters of water between crushed meds and liquid meds, and 10 milliliters of water between each liquid med. After all medications are administered, then flush the tube with 30 milliliters of water. Meds and flushes are now completed. Clamp the tube, remove gloves and goggles. The next step will be to prepare the feeding. First, check the feeding against the MAR to ensure that it is the correct formula. Remove feeding bag. Observe bag with opening on top. This is where the feeding will be poured. Moving down the tube is the chamber, which will be filled halfway when the tubing is primed with the feeding. Further down the tubing is the roller clamp. The roller clamp rolled down tight is closed, rolled up is opened. The roller clamp must be closed at this time. Before pouring the Ensure feeding into the bag, the label must be filled out. Patient's name, room number, time, date, formula, the rate of delivery, which for this Ensure order is 100 milliliters per hour, and your initials written on the label. The label is then placed on the back of the bag, never over the calibrations on the front. Pour the content of the feeding can into the bag. And close the lid. Hang the bag on the pole. Prime the tubing by opening the clamp, inverting the chamber, and allowing the feeding to flow. When the chamber is half full, put the chamber down and continue priming the line. Continue priming the line until all air is gone. The first few drops of feeding may be dripped into the can. Once the priming is complete, put the cap back on the end of the line before loading the feeding pump. We'll now review the pump. It is electric, so it must be plugged into the wall. There is an off-on switch, a start-hold button, numbers on the front in red that show the rate, controller on the side to regulate the rate of flow. Set the correct rate on the pump. The feeding is ordered to infuse at 100 milliliters per hour. Put the chamber into the pump. Pull the tubing around the wheel on the pump and put the black ring into the holder. Flip the clamp over the tubing to ensure proper positioning in the pump. Open the clamp. The feeding will not flow until the pump is turned on. Don goggles and gloves. The nurse may now hook up the feeding to the NG tube. There is no need to flush the tube with 30 milliliters of water at this point because it was already completed after the medications were given. However, if medications were not given before the feedings, then the initial assessment for placement and the water flush would be done prior to starting the feedings. Remove goggles and gloves. Adjust the proper rate on the feeding pump. Turn the machine on. Complete hand hygiene. Complete documentation. Initial each medication that was given at 0900 hours. Be sure to initial the feeding as well. Complete the signature at the bottom of the page with the time 0900 and the signature. Stacy Daniels, SN/NCCC/SD, identifying your initials. X out of the screen. Do not save in the lab. You would save this in your clinical agency. The feeding is now completed. Stop the feeding. Don gloves and goggles. Disconnect the feeding bag tubing from the NG tube. Remove the plunger from the syringe. Flush the NG tube with 30 milliliters of water. Remove syringe. Clamp the end of the NG tube. Remove goggles and gloves. Check the amount of water left in the graduate for an accurate intake. Hand hygiene. Patient safety. Leave head of the bed elevated, bed in the low position, call light present, over bed stand within patient's reach. This now completes the skills video for enteral meds and feeds.